It's going.
Good afternoon. We'd like to welcome our panelists. Today's theme is sickle cell disease, the current medical and mental treatments. And as a part of these professional education presentations, I am the facilitator today. I'm Cynthia Washington Williams. I am a licensed professional counselor, and we're going to be talking about levels of mental health therapy as requested by Sickle Cell Services of COBRA, supported by Medical University of South Carolina's Sickle Cell Disease Program. We're hoping that this panel presentation will benefit not only physicians, support staff, patients, families, and the community. We're going to address some cultural reluctances to mental health. We're going to talk about mental health care, and we're going to give information on types of care. So I'd like for us to start by having each of the panelists just briefly introduce yourselves. Please share your name if you want to share what type of sickle cell that you have, and just something brief about yourself.
Hello, I'm Olivia Peterson. I'm 20 years old, and I have sickle cell anemia, beta thalassemia 0. And there's not really much to me, I'm sorry. But yeah.
Good morning. My name is Cliff. I'm 43. I have sickle cell disease, SS, and I'm a native. I'm a local Charlestonian. And thank you guys for having me to be part of the panel.
Hello, my name is John Taylor Jr. I have sickle cell disease. I'm 32 years old. I consider myself just a community advocate for sickle cell, and just the opportunity to be here it's good to be able to have folks talk about issues that are really personal. And so thank you for the opportunity.
So we are very happy to have the three of you here. So as I stated, I am a licensed professional counselor, and I'd like to know from each of you, when you think of sickle cell and the challenges that you have had or experienced, ones that you've seen in fellow other patients, how do you think mental health is involved?
So sickle cell is one of those things that is very demanding on the body physically. And I think that's what most people recognize, the demand on the physical aspect of your body. But more in depth, looking beyond that, it's really a mental demand. Oftentimes, you find yourself having to struggle to get through just mentally the pain that you may that may occur through a crisis. Even beyond that, just being able to mentally give you that stamina to communicate exactly how you feel right now when you may not want to actually communicate to anyone. And so mental stamina, I think, gets overlooked in sickle cell patients more so than the actual physical pain that happens through crisis.
You have to hold it right up and you have to project a little more.
Okay. Am I fine now, or?
Yeah, it's picking up.
Okay. I think it's a really great question because with sickle cell, a lot of it does have to do with your mental state of mind. And for the most part, I think that has a lot to do with it. What I've observed now is that a lot of healthcare professionals, I can speak for Dr. Martin because that's my physician. They're taking a more holistic approach to it as far as wellness. So in the past, I noticed that when it came to mental health or mental health awareness, it was looked at as something in addition to or something extra. But the approach that she has taken is to incorporate it to where it doesn't feel like you're doing anything other than what you have to do. And the reason why I wanted to make that clear is because with sickle cell, it is overwhelming at times. And to feel like it's one other thing that you have to put on the list, sometimes it can become taxing. And there are issues like anxiety that can affect, excuse me, your health. I've spoken and I've had the experience myself as a, excuse me, as a child. A lot of times with anxiety in general, sometimes you can get so caught up on having a crisis and trying to be aware and controlling everything that you can control, making sure you eat enough, making sure you're hydrated, and if it's on your mind more than usual, I'll say, sometimes it can actually manifest into an actual crisis. So mental health and your physical health, I think it's all one. And like I said, that's, to see the shift. I'm old enough to see the shift where, like I said, physicians like Dr. Martin have taken a holistic approach and she's included it. And she takes the time to discuss these things during my visits. And that's something that I didn't experience in the past.
Speaking from a younger point of view, thankfully mental health has been brought up a lot more. And as someone who only has the full disease in my family, I never had anyone to talk to. So I felt like I was just going through this alone. And I'm originally from Maryland. So I moved down here when I was about 12. So, sorry, I'm trying to get all my thoughts together. Basically, having the team that I have down here has been really helpful because I'm someone who can smile through the pain, and people really don't understand that I might be going through a lot, but I can also smile through it. So knowing that the team knows that even though she's smiling right now, she's probably not having, a great of time, or she's probably still in a lot of pain. So that's one thing that's been really helpful. Yeah.
So what I'm hearing from you wonderful panelists is that mental health is not a curse word. Mental health is not a curse word. And the reason why I say that, because I do agree with you that there's such a stigma around mental health. Sometimes people believe that if there's a mental health issue, it means that something's wrong with you or that you're crazy. But I'm hearing that you all say, as it relates to sickle cell, you're realizing the importance that mental health actually belongs in the category of medical health. And it's just important that as you deal with the pain, as you navigate through the pain, as you mitigate through the pain, that you also need somebody to talk to. You also need somebody to say, okay, we're not going to spend all the time focused so much on the pain, but what are the other things that we can do? How can we deal with the anxiety? How can we deal with the depression? So if depression represents all of my thinking, if I spend so much time being focused on the past, it creates depression. If I spend so much time being focused on the future, the what ifs, like we're doing now with the pandemic, it creates anxiety, like we stated. The goal is, so one of the things that would be a goal with mental health is to help you be more mindful. You may have heard that term, mindfulness, being aware of the present situation, not focused on what's happened that we can't change, or focus on what might happen that we don't have the control over, but being in the present, being in the moment like we are right now. Not figuring, what am I going to eat when I leave here, but being present is really, really important, but also difficult. So what would you say to other patients who might think, I don't see the importance of mental health, or I don't see the correlation? What would you specifically say to a fellow patient who may think, there's nothing wrong with me, I don't think I need to talk to a professional, or not understanding? What would you say?
That's a really great question. What I would say is that's actually part of the problem. You know, it starts with your mindset. And just hearing her speak, I was able to identify some parallels. The first being, I'm the only person in my family with sickle cell. The second is, if I'm having a crisis or if I'm having pain, oftentimes what I've experienced is people don't believe you, that sort of thing. And so that creates other issues. But in terms of mental health, I think the approach, it needs to start in the home, and it needs to start early. The reason why I say that is because there are a lot of barriers to healthcare. And some of the barriers are cultural, specifically in the African American community. A lot of what's believed, a lot of feelings, a lot of perception is tied to the church. So for some people, if you have a mental health issue and you address the issue or you bring it up, then they tie that to a lack of faith, and it becomes a bigger problem. And so one of the things, I don't want to use the word separate. Sometimes you do have to separate the principles of the church in your healthcare, because there's a difference between religion and spirituality. And sometimes people get caught up on the religion, which is the order, the rules, the decorum, until they lose the fact that people are out here that need care. And so, like I said, there are certainly barriers, but a lot of barriers, the first point is to be aware, because sometimes the barriers that exist, you put up. And what I try to tell people is, and it's great to hear, like he just mentioned, that he's an, I'm not sure if he said activist or advocate, I'm sorry, an advocate. And, you know, it was really great to hear that, because what I tell people is the more that we hear the word sickle cell, it loses the stigma, you know, and there's little things. And, you know, I wear my bracelet, and this is actually the color for sickle cell. And it's a conversation starter. You know, the yellow one is cancer. There's another one for breast cancer in particular. And so the more that we can get the conversation going, it lessens the stigma. And as far as mental health, that, for me, that takes down some of the cultural barriers and personal barriers to reinforce the idea that there's consulting a mental health professional is equivalent to consulting your medical doctor. It's all in the same, it's all in the same thing. So I apologize if I was too lengthy.
I'm glad that we're having this conversation. I think it is very important. And to your point that you just mentioned, the stigma around not being able to talk about it is heavy in our community. Just being able to just open up and say, hey, it's okay for you to see a therapist. It's okay for you to see a counselor. Absent of it's regarding sickle cell or not, but just that stigma alone. When you bring in sickle cell, I often think about all the times growing up, being in elementary school or as a young kid, and thinking about the times where folks didn't believe that you're in pain, or wanting and giving myself, having to give excuses that you didn't want to give just to either fit in or do that activity of the day because no one believed your true feelings. And so what I would say to other patients is that you have to have that confidence to let people know truly this is, like you said, being present in the moment. This is truly what I feel, and don't necessarily budge on that. It's oftentimes not even just peers. It could have been teachers, or it could have been administrators. It didn't matter. The blessing in that is I thank God for my parents during that time, because they were ones who really, you ever had those moms who like, I'm coming up to the school kind of deal? That was my mom. Like, she would literally come up to the school if there was an issue. And so I do thank God for her, because she helped me walk through that, being able to say, hey, you need to communicate. This is, if you're in pain, if you need to take a pause. So I think being able to tell other patients, like, knowing how you feel, and don't feel that you have to make an excuse to share that with anyone. I think the other part of this is with mental health, that not wanting to share that information, sometimes you don't necessarily want to share that information. And so that's not necessarily I won't say a good thing, but it's just because you don't want necessarily to put that burden on anyone else. And so, for examples, when I did share feelings, now you got folks who begin to put an emotion of, oh, let's feel sorry for him for this particular day, and then that now extends for the rest of your relationships. And so it's hiding those inner emotions and feelings, to me, has become detrimental to the community. And so being able to have that confidence to vocalize and share openly that this is truly how I feel, it's a good thing. And so I'm glad that we're having this conversation now about being able to be forceful and intentional about mental health, particularly with sickle cell.
And so, as I'm listening, I'm encouraged. As a mental health professional of over 25 years, I too have a therapist. And someone might say, why do you have a therapist? Well, let me tell you. First of all, he's good looking. Secondly, we all need a place where we can be able to share some of the issues that we might be experiencing. Your friends and your family, they're not equipped to be your therapist. Your friends and your family are not equipped to be your therapist. And so talking to a professional is a good thing. And I love how you stated that it belongs in the same category as if you were experiencing cancer, diabetes, hypertension. It really does. And so we want people to understand. We want the stigma to be eradicated, which is why I don't hesitate to share that I have a therapist. As a matter of fact, those who don't have a therapist, I'm more concerned about you, because I think it's something that we really need to remove the stigma and let people make it more comfortable for people to be able to step forth and get the support that they need. Like you all said, for what you're experiencing, talking to a professional, helping them to understand, this is what I'm going through. A mental health professional is not going to give you advice, but they'll help guide. So with that said, what do you believe is important for a mental health professional to know from you? What would you want a mental health professional to know from you and to understand?
I'm just trying to think about it because that question, there's a lot there. And I think it's like any other, I don't have a cold. It's my seasonal allergy, so I don't want to make anybody feel. But I think that there needs to be a clear set of expectations of what the professional expects from the patient and what the patient expects from the professional. Just to kind of backtrack a little bit, when he was talking about, kids or adolescents being in school, when I speak to young people, a lot of it's about fitting in. So it's not so much about sickle cell. They just want to fit in with the crowd. And so instead of going into sickle cell, what I tell them is it's a safety issue. Because if something were to happen, your friends, your family, they need to know what to tell the medical professional. And so, I kind of take that approach with young people because there's a lot of pressure. And a lot of it is awareness. I realized that when I was in high school, that there wasn't social media. So I don't understand the added pressure of social media in regards to young people, but I give them, that courtesy because I realize it is an extra set of pressure. But to go back to the question, I think it needs to be clear what the expectations are. And I think the professional needs to have an understanding of what sickle cell is and just the different nuances of sickle cell and how your situation is fluid. It could change moment to moment, day to day. I know as I got older, professionally, one of the issues that I had, being transparent, letting people know my situation, and I would take the time to explain it to people because you don't want to fall into the stereotypes of, I don't want to hire someone with sickle cell because they may not be reliable or they may not be able to come in. So to combat that, I think people have to be transparent from the beginning. And when you're transparent, what I found is people are more willing to work with you. And part of it is they're trying to create a culture in the workplace where diversity and they want to be inclusive, but also your protection in regards to the law, things such as the American with Disabilities Act. That doesn't kick in with your employer until you put them on notice that you do have sickle cell. So you're not, stating that you do, it doesn't help. But getting back to my situation personally, as I got older professionally, and they would sort of plan out or give you a calendar, meetings and things of that sort. Sometimes you find yourself in a catch-22 because an issue that I had to deal with on a personal level is, and I don't have a whole, lot of things going at one time, but when it happens, It feels like everything has to stop. And people felt like I was picking and choosing what events or what meetings or what things that I was going to, not understanding that the situation is fluid. So, if I schedule something or the company schedule something that day, now I can take a step back and say, well, this is a bit much. I need to insert a break here, or, I need to insert a break there, or I can come late this day or stay later the next. Things like that we can work out. But like I said, when you're transparent, people are more willing to work those things out with you. And for me, it was my way of getting rid of, extinguishing different challenges that I had in the workplace. Yes, ma'am. I was an advocate. And the one thing that I keep in mind as well is once we advocate for ourselves, we're moving the ball forward to advocate for others. Because there are a lot of people that aren't familiar what sickle cell is, what it does to the body, that it is chronic. And so when you advocate, the next person that may come behind you or beside you with sickle cell, that makes it a lot more easier, acceptable, and all of these things lessen the stigma, in my opinion.
You gotta use your mouth.
Would you like to share?
There weren't like tears of sadness at all. It was just mainly tears of finally hearing something that you could relate to and being like, oh, there's actually people that went through what I went through when I was younger. And sorry. No, it's fine. It's just been really tough. I'm so sorry. I'm trying to keep it together.
And so it is okay. This is the importance of what the panel was saying, the importance of us removing the stigma, being able to have these impacting conversations to eradicate, and so that people can get the support. And so when you can hear, like this young lady just said, when you can hear, you know what, I went through that, and you have someone else to say, I experienced the same thing. I know what you're talking about. I'm resonating with your experience. I'm resonating with your experience. That's powerful. That is powerful.
And I truly thank you guys for like speaking on your experience, because everything they said, I went through the same thing. And like sometimes you think that, oh, guys who have sickle cell probably wouldn't go through exactly what you're going through, but hearing them say exactly how I felt, like in elementary school, I was basically the only one with sickle cell, so kids didn't understand. And I would go and tell them like, oh, I have a disease, and they're immediately like, oh no, she has a disease, don't get near her. And I never realized like the mental toll that took on me. Sorry. Feeling like an outcast, but also then having people that support you. It was just, I wasn't able to even really explain it at all. Having nurses sit there and be like, are you sure you're in pain? And like, being like, let me call your mom first before I give you this medicine. And I'm just like, well, she obviously gave you permission if you have my medicine in the nurse's station, And also having to sit out on vacations. Like I remember one time my grandmother took me to the beach, and she didn't know that cold water could affect you. So she was like terribly upset. And like, I didn't know how to feel because I was upset too, because I was like, I was having fun, but I had to stop and go to the hospital because of this one thing. And, sorry, I also have a younger brother who doesn't have sickle cell. So seeing him get to achieve so much more than what I could have done, it hurts, you know? Like, I appreciate him taking the time to help me and, you know, be patient with me, but it hurts really bad, you know? And trying to find somebody who can understand how hurt I feel is hard because, you know, people are like, well, God gave that to you because you're stronger, you know, you could handle it. And like how you said about, you know, people saying that you just lack faith if you know, if you're feeling like you're going through something. Like just the other day, I was having, you know, a panic attack, and my grandmother was just like, well, we could have just gone shopping, you know, we could have just done that, and maybe that would have helped you feel better. But I'm just like, no, me going out wouldn't necessarily make me feel better. And trying to get her to understand has been pretty tough, you know, because she grew up in the older generation. She's like a baby boomer, so their generation didn't grow up with depression or anxiety because in the eyes of them, that was a white people thing, you know? And it's just been hard trying to deal with my emotions, but also stay strong so I don't feel like I'm burdening my family with all of my pain. And sorry, it's just actually gotten a lot worse for me lately. My high school career, I basically didn't even have much of like, you know, fond memories of high school because I was either at home sick, at the doctor's office, in the hospital, or, you know, just barely even there in school, barely even paying attention. Like, it hurt to go to school knowing that I would have to sit in a class and be in so much pain, but also have to, you know, pay attention and make sure I get good grades. And that really also took a toll on me to where, you know, I'm sorry.
It's okay.
Like, you, when the bad thoughts started to seep in, because like, I literally had to put my life on a standstill because of this illness. And hearing that, you know, you actually work kind of helps me feel a little bit better. Because, like, I had to stop my job in my senior year because I just was too sick and I was just into, like, a hospital way too much. And it's just something that it's hard to deal with.
It's hard to deal with. You know, yes, go ahead.
Just knowing what you're going through, I just wanted to let you know it's okay to accept the fact that you didn't do anything wrong and there aren't any standstills. Everybody has a different track, a different pace in life, and you're doing life at your pace. You're not behind. Don't think that you're behind because somebody your age may be doing this. When the time comes, or if that's what you want to do, then it'll happen. But don't ever feel like it's a standstill or it's a burden because, you know, we all have things to deal with. You have people that deal with diabetes. You have people, and sickle cell is a chronic illness. So by it being chronic, there are a lot of other illnesses that are chronic. And so your family, don't look at yourself or feel like you're a burden. That's the team that God gave you to help you through. And there are things, you know, by you going through your experience, you don't know that there are things that they are helping you with. I'm the only one in my family with sickle cell, but seeing my siblings do certain things helps me. And sometimes I can help them. But I think what probably adds to it for you is people think that there's a look. You don't look like anything is wrong with you.
Oh, yeah, I got that so much because, you know, I can't say majority, but a good amount of people with sickle cell tend to be thinner. So I would get older people being like, "You really have sickle cell? Really? Oh, okay." And I was like, "Well, I know I'm, bigger or on the bigger side, but that doesn't mean my sickle cell doesn't affect me the same way it affects a skinnier person. So that's one thing that's been.
One of the things that Dr. Martin and I were discussing during the break was the importance of support group. She and I are big proponents of the importance of a support group like we're experiencing now, when you can hear someone else resonate with what you're experiencing and have somebody understand. And the importance, I believe, of mental health support where you can express yourself, where you will not be judged by whatever it is that you are feeling, and you will be believed. What it would be like trying to feel like you have to convince somebody that you are not participating, not because you're lazy, but because you're actually in pain. But like you all said, if someone doesn't have that understanding of the disease, then they make inappropriate, I'll say it like that, inappropriate comments. And the same kind of comments, like when you talked about the baby boomers, I do think that depending on the generation, a lot of people still do have the stigma, not only about that, but also about mental health. And that's why I think we have to talk about it. We have to correct it. We have to help eradicate it. We just have to try to help people understand, which is why I don't hesitate to share that even as a therapist, I know what it's like to go and sit in the waiting room and have a therapist appointment. I believe in it. I don't just talk about it. I don't just provide it, but I believe in it and I do it for myself. And so I'm going to continue to be transparent and let people know that. And I'm hoping that others will do the same. So just like you said, so people can begin to say, so wait a minute, you mean to tell me if I'm having these issues, I can actually go talk to a professional and it doesn't mean I'm crazy, even if no one in the family understands, even if no one in your tribe supports it. Do it for yourself. Do it for yourself because it is important. It is important. And all of the things that we are experiencing now, and we could be here all day talking about not only sickle cell, but how people have been affected and impacted by the pandemic, and all of the different vicissitudes of life that we're experiencing. Mental health, your checkup from the neck up is important. Having the checkup from the neck up is just as important. It's very important. Yes, you may.
So we talk about support groups, and the thing that comes to mind, I always have a sickle cell story, if you will, that connects to it. One of my good friends in middle school, we both had sickle cell, and we became really close because of that fact of sickle cell. We were in the same classes. Went to MUSC together, not necessarily together, but there'd be times where we see each other. We got to a point where he would communicate, hey, I got transfusions next week or whatever. And so we're exchanging class homework notes and that kind of thing to just kind of rely on each other. Our parents helped us do that as well, like saying, hey, did you check on such and such for that reason? And not till really having this conversation, in the light of it, looking back, I didn't really see the magnitude of it. It was just something that you found a connection and you just kind of live with it. But in the magnitude of this moment, being able to communicate that, hey, finding, like you said, someone who understands your situation is very important. I go back even to, and so we've been really talking about patience and family support, but really, I felt the need to even address situation in the emergency room. The emergency professionals being admitted into a hospital during that intake process and having to be questioned, oh, are you really in pain, or do we really need to prescribe this medicine for you? That's the things that really is painful. So the pain that you're dealing with is almost subdued because now you are dealing with this mental trust issue, if you will, where you're a healthcare provider and now you don't want to administer whatever that may be, whether it's because of stigma, whether it's because the fact that certain medications are addictive, whatever it may be, but that's the pain from the mental side that is fused into the situation. So for a period of time, there was times where I was like, I didn't want to go to the emergency room if I'm in pain. I didn't want to go and sit in a waiting room for hours and hours. Even if I went to the waiting room, then you get checked in and you sit in triage and you sit in a waiting room and waiting for a doctor. And this is no shade to Dr. Martin and Dr. Jackson. They've been amazing in my life. Dr. Jackson, she probably may not remember this, but Dr. Jackson called me on my first day of grad school. And it was so surprising to me that first I didn't recognize the number, but it never appeared to me that I would get a call. And since then, she's been able to just remember everything about my life to this day. And it's like, that's the type of support system, someone who walks in this arena of sickle cell and being able to communicate that to others. So that's the thing I want to, if we're pitching this mental health and support group, it's being able to see what good support looks like and mirroring and sharing what that feels like with others, because all of us need support differently. Sometimes I don't want to be around people. Sometimes, even if you're feeling okay, even if you just don't want to be bothered sometimes. And so it's just knowing how to communicate in the moment. It's really painful to have to want to subdue those emotions and feelings because you are prepared for the reaction that is not accepting for where you are right now. And so I think having the support group, if we're able to garner just a network that shows what true support looks like and being able to identify that for patients, it means tremendous work, in my opinion. It is really a blessing to be able to go to someone. And I mean, for me personally, I just recently began seeing a therapist, and it's been really helpful. Just knowing that the stigma that we mentioned earlier around mental health is, we have to eradicate that. We really do. Yeah.
Well, I just want to say everything he said is 100% true. I just started going to the ER because as a 20-year-old, I can't go back to the peds. But I remember my first time there, we waited 6 hours in the waiting room. And it wasn't until I went back there and they were reading my chart. And as I said, I had a spike in crisis, so I was just going to the hospital a lot. And I remember the doctor looking at me and being like, "Are you sure you need to come in?" And I'm just like, well, why would I be at the ER if I don't need, pain medicine or anything? And she was saying, well, you've been coming pretty often. And I was like, well, yeah, that's, and it wasn't until I realized she was insinuating that I'm drug seeking. And as an 18-year-old, you're like, no, I'm not drug seeking. I'm just trying to come and get help, And sorry.
So let me ask you all, if this room was filled with emergency physicians, professionals, what is the message that you all would like to have them hear?
Okay, I think am I close enough? Because I can't.
You're fine.
Tell. Okay. I think the first thing that we can start with, a good starting point would be to the medical professionals, especially in the emergency room. You have to separate facts from feelings, because feelings create a lot of bias, disparities, things of that sort. The fact is, among the sickle cell population, the addiction rate is actually lower than the general population, and we deal with more pain than the average person. So that in itself says a lot. In regards to the emergency room, I think that they look at your behavior, your appearance, things that shouldn't matter in administering healthcare. It becomes an issue. When you're in pain and you ask them, if they ask you, for instance, how are you feeling? And did your pain level go down? And you say, no, ma'am, it didn't. And, the next thing is they insinuate you're clock watching, things like that, or you don't look like you're having a crisis. You don't act like you're having a crisis. We ran your labs, and I actually asked other sickle cell patients because I wanted to know if it was just me, or when it came to this issue specifically. But I don't understand what test or what labs you can run that would tell you an individual is in pain or is having a crisis. And oftentimes what happens is it becomes worse. Something that can be treated becomes an admission because they don't administer, or they won't administer, enough pain medication, and then the pain accelerates to the point where it's out of control, and now you have to admit the person. Conversely, if you had taken an aggressive approach, provided them sufficient amount of medication from the start, reduced the wait time, you could have sent the person home, because like she said, that's the last place they would want to be. Another interesting point that she brought out is there's a shock value coming from pediatrics to adult. When you, like I said, because I'm considerably older, and it can be very traumatic, because when you're as a pediatric, they rush you in, they hurry up and triage you, and everything is right here, right now. And before you know it, they're doing everything to get you home. That seems to be the goal. Now, when it comes to adult, you may go in for triage, and you may wait 4 to 6 hours. And there's been times I've waited even longer. And the thing is, when I say we, people with sickle cell, we try to live as normal of a life as we can. That's the goal every day. And, it's just, it's something he mentioned. he went to school, and I did the same thing. And I was actually working on my doctor's degree, but I haven't completed it yet. But I've had people ask me in the emergency room, well, how much pain can you be in if you can study? Things like that. So it's almost, what you would consider an accomplishment would be used against you. Things like, and it amounts to making the person feel like they're a drug seeker, or making them feel, I need you to convince me and tell me why you deserve for us to treat you. And if I could address emergency personnel, like you said in your question, it would be this. We don't want special treatment. We don't want you to bend over backwards. We just want you to uphold the oath that you took to do no harm and be respectful. That's what we're looking for.
I feel exactly the same way. As I said before, I'm someone who can smile through the pain. So someone looking at me being like, are you sure you're in pain? Are you sure you need that third dose? It boils my blood. And I don't want that stigma being the angry Black woman. So I try to stay as calm as I can be, try to look. It's like the fact that I have to look sick just to get any help is ridiculous. Because I don't know what looking sick looks like, This is just how I am. Like right now, my knee is hurting. But right now, I'm, talking and trying to, participate, because I don't want to be the person that has to go out and sit down and everyone has to cater to her. Like, I don't like being that person. So I just wish that they would listen and try to understand. Like, just try to put yourself in our shoes. You're coming in, this is your last resort. All you need is just some medication to nip it in the bud. And I'm someone who likes to personally, like if I'm having a crisis, I like to try to take care of it at home with my pain meds and with other, options that I have. But the fact is that you're sitting there questioning me on how much I'm paining right now makes me question myself. Am I really paining? Am I really in that much pain? Do I really need that medicine, And it's hard to even try to even convey how much pain I am. Because, they can ask you from a scale of 1 to 10, how do you feel? And you can say 100, and they'll be like, yeah, but you don't look like you're at 100, And yeah, I don't even know what else to say.
As I was listening at the three of you express so succinctly, it really made me think of how one of the things that I mentioned in the earlier presentation was it's hard when what you're experiencing is invisible. I was sharing that a lot of the work that I do with the military, traumatic brain illnesses, TBI, trauma, when you experience trauma. As a society, we don't do well if we can't see it. If you presented with a brace on your knee, that's visible. If you presented with a brace on your arm, that's visible. If you come in and you're bleeding, you've been in an accident, that's visible. But what you all are describing, such as mental illness, it's not visible. And I do know that a lot of times people struggle with what's not visible. So it's real because you're experiencing it, just like people have mental illness struggles, but it's not visible. Oh, well, you don't look like anything's wrong with you. I mean, you have your Michael Kors outfit and your hair is done, or, you look so neat. What do you mean you have an issue? And that is why I am such an advocate of mental health. It's why I went in the field, because I've seen so many times that what people are experiencing, it may not be visible to the naked eye, but it doesn't mean it's not real. Yes.
One more thing. I know that there is a book out there that claims that Black women can take more pain than other races. I just want to say that is completely not true. There are some pains that my white friends could take that I couldn't take at all. So I just want that stigma to just disappear completely, because it's not true whatsoever. Okay, that's it.
She actually said what I was thinking, because they recently did a study, and can't think of the name of it, but what was the most alarming for me is that you have students in medical school that still believe these sorts of things. Certain individuals, a certain group of people, can't feel pain or can tolerate pain, or their skin is thicker. And when you break it down on a biological level, we're the same. So we know whether
You say that again for the people in the back.
on a biological level, we are all the same. And so we know where the ideas, the mindset, we know where it originated, but we also know where it needs to stop. Simply because what you're treating is invisible, you start to treat the person as if they're invisible. And that's worst. To make an individual feel like they're a drug addict. And like she said, her being a young person, like that's not the thing to do. Like, I'm gonna go to the emergency room. I need something to do. Like, no, there's things that she probably would want to do as a young person, even if it's just going out with her friends or things younger people do, then go to the emergency room. And I just wish that a lot of people in the medical profession would give us, as sickle cell patients, the grace and the courtesy that we give them, because they are dealing with people in general on their worst day. If you were to meet that individual on another day, you may very well get along, but they're having a crisis. But it's no different than an individual coming in that I have a friend, he has pancreatitis. I met someone in the ER with Crohn's disease. The treatment is night and day. So we know, like I said, we know where it started and we know where it has to end.
So as we talk about this, I think it's important that we begin to share some resources. We've talked about the importance of mental health. We've talked about a lot of things, but I think it is important that we talk about some of the sources. And so one of the resources is, if you are employed, a lot of employers offer what is called the Employee Assistance Program. The Employee Assistance Program is a benefit that is provided by your employer that allows you to have prepaid sessions. And so one of the things that I'm really excited about is Sickle Cell Services of Cobra here in Charleston have some contributions. And so I'm going to be able to see sickle cell patients for up to 6 sessions or until the contributions are exhausted. So that's a resource that I definitely wanted to share. Mrs. Cook made me aware of that. That's one resource. The other resource, like I stated, is the Employee Assistance Program. Many employers offer this. It's such an underutilized benefit. I'm actually on the panel here for the Medical University of South Carolina. So for employees that work here and their families, they also get to utilize me for prepaid services. So that's one area. Insurance, you have to, yes, you will have to find the provider that accepts insurance, in which you would pay a copay, and then that provider would bill your insurance carrier for the remainder. We also know that there are lots of Medicaid programs. Once again, you would have to find a provider. And so I'm just sharing, those are some resources, and there are many others. There are some free resources, you can go online. Because I think what happens is, at least one of the things that I hear a lot are people say to me, yes, I admit it, I would love to go to therapy, I can't afford it. And most of the time I'll say, do you work? Yes, ma'am, I work. And when they tell me what, I said, well, contact your human resources representative and find out. And 98% of the time, people call back and say, I didn't even know that existed. So I'm the poster child for the Employee Assistance Program because it's a prepaid service. And I want people to get the support that they need. We talked about the importance of mental health. We talked about the importance of having support. We talked about the importance of self-care, taking care of yourself, getting your needed rest. All of these things are important so that you can have the best quality life. And so this panel has been phenomenal. I want to thank you 3 panelists for being here, for sharing, for being transparent, and for having this extremely important dialogue as I think we have done a good job of eradicating the stigma. I think that we have the tools in our toolkit that when we see someone who maybe is just not educated about, a lot of times people make comments, and you all have educated me today even the more about sickle cell. So even as I'm dealing with my patients that have sickle cell, you've helped me. And so I think that if we can collectively empower and educate and eradicate the stigma, and even you mentioned about the church. And I said earlier, a lot of times we're told, you need to just pray about it. However, you can have Jesus and a therapist. You can have both. You can have your spirituality and a therapist. When you go to the doctor, it's the same thing. So what would be your closing comments today? What would be your closing comments today?
I think in closing, a lot has been said. I've certainly learned a lot. Just being on the panel and listening to their stories, you being here, everybody participating. Excuse me. For me, I feel like I get even more out of it since like I said, to reiterate it, I am the only person in my family with it. So just to be around other people, it does a lot for me. But in closing, a lot has been said, but what isn't, if I haven't made it clear, there has been a lot of progress. In mental health, you mentioned it. It's just another tool to put in your toolkit, one of many tools to get you through life. And the reason why I say that we've made a lot of progress is because years ago, this would not have taken place. So for us to simply be here, that in itself lets us know that we've pushed the ball further to the goal. And I'm happy about it because it brings a lot of awareness, and it's going to take dialogue to eradicate the stigma. I think it may take further dialogue among those that are in the medical profession so that they can move the ball further. And like I said, a lot of it is the renewing of the mind. There are a lot of beliefs, attitudes, perceptions that are strongly held that it's time for those to be let go. And I think that I feel optimistic about the future in spite of my experiences, in the emergency room and things of that sort. So again, I'm humbled and I'm grateful just to even be here. And thank you to everybody for sharing their stories, because just because we have sickle cell, it still helps to share and exchange information and ideas and things of that sort.
I just wanted to thank everyone for being here because, as you said, it's a step forward, We're able to get the word out there. And I also want to be an advocate as well. I want everybody in this world to know about sickle cell. I don't want it to just be something that, a few people know, some really don't understand it. I want the definition. I want the people who do have it to speak out and, educate everyone about it, because it is something that it's pretty hard to go through. But I do want, next time to be more people with sickle cell to tell their stories. Because as we know, not everybody experienced the same thing. We all go through different, paths and have different ways of dealing with sickle cell. So I hope that's something that in the future we can all have just a huge group of people come and talk.
Thank you.
I began today's session saying I was appreciative of us having this conversation. Change really only can happen when we begin those difficult conversations. So mental health, like I said earlier, it's a difficult conversation, especially for our community. And so I am just thankful for this moment for us to have just a conversation, because that's one of those beginning steps, at least. Being forward thinking like that, we can get there if we get at least to open the door to have a conversation on what is it, recognizing that there is an issue. So I'm just thankful for this. The second point that I probably will close with is I'm encouraged by this because I know that there are other people that have the same heart and intent to share the pressures, the stress, the nuances of what sickle cell patients deal with. I got a story. Of course, I told you I have a sickle cell story that there's so many of them, but I remember being admitted into a hospital and as I don't remember, maybe around elementary school, whatnot. And one of the things about being admitted is you learn about the amenities. In the old hospital was the atrium, and the atrium in MUSC had any and every toy, game, anything that you can imagine in that space. And it was always sad that when you're in the hospital and you couldn't go to that space. And I bring this story up because when we go back to the whole support thing, my cousins and my uncles and those who would come to visit, it almost felt like they just wanted to come so they can go to the atrium and play in the atrium, regardless if I'm the one here sick. Like, you ain't gonna be sick no more and we can't go to the atrium. And so it just gives me that story to say there are people that are willing to support us if we are willing to share our story transparently. And so let's continue to do that, just to share openly and honestly our story. And that's the beginning of becoming better advocates for sickle cell and mental health.
On behalf of COBRA, which that acronym is the Committee on Better Racial Assurance and Medical University of South Carolina, I want to thank the three of you phenomenal panelists for being here, helping us to unpack this very timely, very important conversation. And I want to thank you for your participation and thank you for your time being here. I feel like I'm all the better for it. And I just want to thank you. So we thank Sickle Cell Services of COBRA and Medical University of South Carolina today. This concludes our presentation.